Chapter 8, Caffeine. This is the full video of my lecture for the substance use disorder counseling and chemical dependency classes. In this chapter we discuss caffeine and its odd status. Caffeine and related compounds are found in a number of plants. Sometimes caffeine is consumed as a beverage as part of meals. Caffeine can also be an ingredient in both prescription and over-the-counter medications. Caffeine can have both positive and negative health consequences. This video is by David Joel Miller. Some of the material was originally on the counselorsoapbox.com blog. The photos are courtesy of pixabay.com and Wikimedia Commons and licensed under the Creative Commons free for commercial use, no attribution required licenses. When we think of caffeine, most Americans think of coffee, but caffeine is part of a family of related compounds. Caffeine being the most common and prevalent, but theophylline is found in tea, theobromide is found in milk chocolate. Related compounds, stimulants, mild stimulants, occur in about 60 different species of plants. Caffeine is the strongest and most common of those stimulant compounds. The use of caffeine is probably ancient. It was used in the Old Stone Age, used extensively in Arabia, and in China in the form of tea. It was not used in Europe at the time of Columbus, but introduced slightly later and is credited with being connected with the Renaissance. Caffeine is a cradle-to-grave drug. Very young children consume beverages that contain caffeine, and senior citizens frequently drink their coffee or tea. Caffeine has some beneficial properties depending on the individual, and we'll look at that in future slides. Caffeine use is common. 90% of the world population uses caffeine on a regular basis. There's been an increasing use by children. Because of low body weights, children get higher effective doses. Use of energy drinks and sodas has obscured the level of caffeine use. Little is known about caffeine's effect on children, and it's not possible to do long-term compared studies by making some children consume large amounts and others not allowed to have it. Withdrawal effects, however, we know are seen by the time a child reaches age 11 in some children. What are the problems with caffeine use? Well, adults with anxiety disorders, especially generalized anxiety disorders, should not consume caffeine, or at least certainly should moderate their use of it, as it makes anxiety disorders worse. Children with diabetes should not have caffeine, particularly in a beverage like soda, which combines caffeine and sugar. Anyone with a seizure disorder, cardiac abnormalities, mood disorders, mainly depression, but also bipolar, and behavioral disorders in children should not consume caffeine. Caffeine does have withdrawal, and people who have an intermittent supply may have a problem with that withdrawal. Another problem with caffeine use is that energy drinks, which may contain large amounts of caffeine, are often mixed with alcohol. This means that the person consumes more caffeine and more alcohol than they would otherwise. The pharmacology of caffeine. Absorption. Caffeine is rapidly absorbed. It peaks 15 to 45 minutes after consumption, and the half-life can vary from 3 to 5 hours, which probably explains that mid-morning slump for many caffeine drinkers as the caffeine is metabolized below the half point. Distribution. Caffeine rapidly dissolves in water, therefore it gets into the blood easily and goes everywhere. It also crosses the placenta to the fetus, so unborn children are already consuming caffeine on a daily basis. More on the pharmacology of caffeine, the metabolism, mostly in the liver. But we have to ask, what about when alcohol is present? In that case, the liver tends to focus on the alcohol and there is slower caffeine metabolism. Elimination, largely in the kidneys. Some can happen in the feces. Caffeine can also be excreted in saliva, semen, and breast milk. Other drugs and interactions with other drugs affect caffeine metabolism. Other factors about caffeine metabolism. Caffeine slows the metabolism of oral contraceptives, and people with liver disease metabolize caffeine more slowly. It also slows metabolism in those who are pregnant. What speeds up metabolism of caffeine? Nicotine. Smokers go through their caffeine much more rapidly. And caffeine can vary in their effects when mixed with other therapeutic drugs. Caffeine tolerance and dependence. Caffeine shows definite withdrawal. Withdrawal consists of headaches, fatigue, depression, decreased alertness, less contentment, decreased activity and energy, sleepiness and drowsiness, increased irritability. And caffeine withdrawal can be the result of as little as 300 milligrams per day for 3 consecutive days. Caffeine is an excellent example of selective tolerance. Caffeine consumers build tolerance to the effects on renal function, to its effects on sleep. I think many of us know someone who consumes coffee right before bedtime and still sleeps just fine. People also build tolerance to caffeine's effect on blood pressure. If you consume it on a regular basis, it does not increase blood pressure the same way it would on someone who rarely consumes it. And you can build tolerance to caffeine's effect on the heart rate. However, people don't seem to build tolerance to its stimulant effects. Even the people who consume it right before bedtime and sleep just fine still report that when they have it first thing in the morning, it helps them to wake up and get moving. The acute effects of caffeine. Mood, it elevates the mood. It improves performance. It is a stimulant drug. It decreases fatigue and increases vigilance. The effects depend on the dosage, setting, and the personality of the user, and it increases exertion and endurance. Interactions between caffeine, nicotine, and alcohol. These three are the world's top 3 drugs, although certainly marijuana use is moving up closer to these 3. Those 3 drugs, caffeine, nicotine, and alcohol, are often used in combination. Caffeine use reduces smoking for light caffeine users. Caffeine metabolizes faster in smokers, and there are state-dependent learning for combinations of these drugs. Caffeinism, or caffeine intoxication, is a concern. High levels of caffeine look like anxiety and stress-related disorders. They can send someone to the hospital emergency room. There is an LD50, a dose which 50% of people would die if they consumed that level. And LD50 for caffeine is about 10 grams. This is 75 cups of coffee or 200 colas in a day. Probably most people cannot consume that much, or 100 no-dose. The problem comes when people consume caffeine in a beverage and take pills such as no-dose that are heavy in caffeine. At that point, it may be possible to reach a lethal dose. There are some chronic effects of caffeine use. For women, more caffeine increases the amount of osteoporosis. However, 1 glass of milk per day eliminates this risk. Caffeine also results in lower rates of conception. Still, drinking a lot of coffee is not considered an effective birth control method. Long-term studies have shown an interesting link between people consuming coffee and having lower death rates from diabetes, heart disease, respiratory disease, stroke, and infection. These benefits seem to be largely centered on people who drank regular caffeinated coffee and without sugar in them. The combination of sugar and caffeine is hard on the pancreas and not a good idea for people with diabetes. Coffee prevents chronic disease. This prevention seems to be limited to regular caffeinated coffee. Decaf coffee is typically made from a different species of coffee bean, which doesn't seem to have the same disease-preventing benefits. But the chronic diseases that regular coffee seems to prevent are liver disease, Parkinson's. It's also helpful in reducing the symptoms of the shakes in people with Parkinson's. It seems to prevent the onset of type 2 diabetes, cirrhosis of the liver, especially alcoholic cirrhosis. Consuming a lot of coffee seems to reduce the risk of Alzheimer's. We have no idea why. And it reduces the risk of pancreatic cancer, but only if it is consumed without sugar. Who should limit or reduce caffeine use? After looking at the list of diseases that caffeine may prevent or reduce symptoms, you would think that caffeine might be good for everyone, but there are some people who should not use caffeine or should limit their usage. Anyone with an anxiety disorder, their disorder is likely to be made more severe by consuming caffeine. Anyone with what we call a stress or trauma-related disorder, this would include PTSD, but also acute stress disorders and adjustment disorders. Pregnant women should reduce or limit their caffeine use, and we believe that extremely small children should not be given caffeinated sodas or get caffeine in other forms. Therapeutic or medical uses of caffeine. Well, many people are familiar with consuming beverages which contain caffeine. Most of the therapeutic use of caffeine goes unnoticed because it's an ingredient in many over-the-counter meds. This is a cosmetic department. I couldn't find one of the aisle with all of the over-the-counter medications. But if you walk down through any pharmacy down the over-the-counter medication aisle, you'll find that a great many of the products, when you pick them up and read the ingredients, contain caffeine as one of their major ingredients. It's found in medication for headaches, colds, respiratory problems, appetite suppressants, diuretics, alertness, and drowsiness. You'll find it in backache pills, migraine pills, PMS pills, all kinds of medications that are over the counter also contain caffeine. Chapter 8 on caffeine. What are the terms that might be new to you that you should know? Well, caffeine, certainly, and the awareness of how common it is in everything in our society and everyone using it. Related compounds to caffeine are theophylline and T-theobromide found in chocolate. The idea that there is a caffeinism or caffeine intoxication and that people who overdose on caffeine can have an increase in anxiety symptoms, maybe even in chest pains that might send them to the hospital. What should you have learned in this chapter? Some of the big takeaways, lessons should be that caffeine and related compounds are found in many plants, but coffee is the major source. 90% of the Earth's population regularly uses caffeine in some form. The largest dose per pound of body weight is in preschool children. People with anxiety disorders and related disorders should not consume caffeine. Caffeine may protect the liver from harm. Caffeine is an example of selective tolerance, and it alters metabolism of other drugs. There are many interactions. Caffeine is commonly found in over-the-counter medications.